This is Mekelle Hospital. It is the second largest hospital in Mekelle and provides care for tens of thousands of patients across the state. But like many health facilities across the state, the start of conflict in November 2020 has severely limited the hospital's capacity to provide care for its patients. Systematic destruction and looting of medical equipment, in addition to an almost 9 months long siege on the region that has prevented basic medical supplies from reaching the capital, has meant that millions across the state will have to go without much needed medical supplies. The impact on the health professionals has also been devastating, with many suffering from mental as well as physical trauma. Dr. Emmanuel Gabramedhin is a general practitioner at Mekelle Hospital. He says health professionals are using what little of their own funds they have available to purchase medication from private dealers because they are afraid of losing patients.
አይነት ሓደ ሽኮር ታይፕ 1 ዲኤም ንብሎ እዩ ኢንሱሊን ተጠቃሚ እዩ
Recently, I was treating a patient with diabetes type 1. His sugar level was at 22 when I first took his levels. As soon as I administered insulin, his sugar level declined immediately. It turns out he had not had breakfast that day because he had nothing to eat. We usually give our patients glucose 40% detries when something like this happened. But our hospital was empty. So I have to go to private pharmacy that had few doses left. I just wanted to run out of the hospital that day. I cried a lot that day. We're not even asking for medication for complicated diseases. We're talking about basic medication necessary to treat illness that takes seconds to treat.
Dr. Emmanuel said he's worried about how health professionals may be dealing with the impact of watching patients die due to easily preventable illnesses.
ሳይኮሎጂካሊ ኢምፓክት ክትሪኦ ከለኻ
The psychological impact is immeasurable. You can't really eat or sleep. We recently lost a patient aged between 34 to 35 due to lack of medication and oxygen. It couldn't let you eat or sleep well either. I couldn't eat anything at home that day. It is very hurtful to lose a young soul with many hopes.
Sister Hiot Aragawi, a coordinator of the ART Center at Mekelle Hospital, said that the very thing that made me stressed each day is the thought of how to tell my patients about the depletion of medical supplies.
It's the most difficult thing to work in this condition. It's difficult to have to tell your patients that there's no medication. Every time I come to work, I'm worried about having to tell the patients that there's no medication. I know I can't leave my work here. I have a responsibility here, but it's so difficult knowing that there's nothing that can be done for your patients.
According to Dr. Philemon Masfin, Chief Executive Officer of Mekelle General Hospital, telling patients that there is no medicine is an agonizing experience.
Even if they get to be seen in our hospital, when we tell them for some medications, we just refer our patients to some private pharmacies, which I think could be a little bit, the price could be a little bit expensive. So just because he was denied of his or her salary, he or not, she is not getting, they are not getting the medications, even to buy from the outside. Even if the medications are available, sometimes they are not able to buy the medications. You can imagine how the blockage affects every aspect, not only the health, the economical, the social aspect of our people. So you can imagine a farmer, a simple farmer coming from the rural area, needing a simple medication for a simple disease, but the agony of telling him that it's not available, that you cannot help him, it really hurts.
Dr. Hagos Kodofai, head of Tigray's Bureau of Health, says the agony of healthcare workers has been worsened by the siege on the region. That has meant that health workers have not received a salary for over 9 months.
It's not the siege only, by the way. Even during the 8 months war, most of our health workforces were like scattered, displaced within Tigray and out of Tigray. Many health professionals were seeking refuge camp in neighboring Sudan, still serving the displaced people in the camp at Sudan. So they are directly affected. It's not only that. Still, because of the siege, they are not like paid for 8 months, but they are striving day and night to serve the people. They are working day and night. They are committed enough without having food, without having salary by serving the people, serving the people as a first priority. But currently, we've been reviewing, by the way, with the World Health Office heads and with the hospital heads, when we were trying to collect information from them directly. Many of them, by the way, they were like, especially in the rural areas, they were supported by the local community because they don't have food to eat and they don't have also salary. So they were like getting support from the local community as a contribution. The local community contributes like cereals from what they have. But now it's really difficult also for the farmers to provide the contribution because they don't have food to eat for themselves as well.
According to data from the Bureau of Health, over 37 health professionals have been killed since the start of the conflict. Over 37 health professionals have been killed since the start of the conflict, while 78 have been injured, and more than 4,000 health workers have either been internally displaced or are seeking refuge in neighboring Sudan.